All right, the clock is ticking, so thank you. It's a real pleasure to be here. I think one of the great challenges of dealing with and having the opportunity to use digital systems to detect diseases is that you have access to a massive amount of information. But the biggest challenge, of course, is then you have to manage that information, and we've heard problems with signal to noise and so forth. One of the key questions is, how do we use this information effectively? Now, whenever we get news of an emerging threat, we have to assess essentially what its impact is. How likely is it to cause a significant public health effect? And we have to think about that not only in terms of the source of where this is occurring, but we also have to ask ourselves, if this were to land in our backyard, what would the implications be over there? And then, more importantly, how likely is this going to actually get from its point of origin to where I happen to be right now? Now, understanding that is complex because we have to understand how the whole world is interconnected. And we have to understand where people are moving because essentially the airline transportation network is an important conduit for the movement of people and conduit for the movement of infectious diseases. Now, I've been studying this for a number of years, and I have to say, as a clinician, I understand anatomy and physiology best. When I look at this, I kind of see a system of arteries, a lot like the arteries in our own body. So this strikes me as being a lot like a living system. And if I take that metaphor a little further and I say, this is what it looks like if you see blood flowing through a person's artery over 10 seconds, and then I compare that with the flow of people through a city like Vancouver over 10 years, you can quickly see this system is a lot like a physiologic entity. It has its own anatomy, and it has its own physiology. And like a person, it can actually get sick from things like infectious disease outbreaks, terrorism, natural disasters, and so forth. But understanding the behavior of this system is critically important to understanding infectious diseases in a world that's increasingly interconnected. Now, we've used this type of information to try and anticipate how infectious diseases are going to spread through the movements of people. One of the key challenges I think that we face is that with peer-reviewed articles, by the time that actually reaches the end user, the information is already too late. And what we need are systems that are timely, that we can generate information in minutes rather than months so that the information is actionable, and we need broad access so that people can access this information anywhere, anytime. Now, this is just a video here of a system I've been working on in Toronto called BioDiaspora, and it's basically incorporating information on the full flight itineraries of about 95% of every flight and trip that's made worldwide. So about 13 billion passenger movements over the last 6 years. Now, we're focusing on transportation because that's an important area of our expertise, but we're also integrating information across other areas because we want to understand if pathogens have the conditions to be able to complete their life cycle in a particular geographic space. And so we're parceling the world off into these geographic units, about 163,000 of them, these hexagons, and incorporating information on humans, animal populations, climatic conditions, deviations from expected climate conditions, and so on and so forth. And then the relationships between all of these spatial units are defined in space and time by how we all interact with one another through a global community, through international air travel. Now, we've been using this to think not only about how to predict where diseases are going to spread once we know about them, but we can also use the same tools to start thinking about, can we actually identify the local convergence of global risks in space and time? Essentially, are the conditions there for an outbreak to occur? Now, that's obviously a big question, but one of the areas that we've been taking a sort of first step into this is with mass gatherings. And we're sort of cheating a little bit because mass gatherings, you know where they're happening and when they're going to happen. But we've taken an initial step by looking at the movements of travelers into Vancouver from around the world, and then with our colleagues at HealthMap have coupled event-based surveillance and actually directed where we want to be targeting our surveillance to specific areas of the world where travelers are most likely to be moving into Vancouver at the time of the Games. Now, I'm just going to show you a video of how we have been working with the Health Protection Agency in the UK for the 2012 Games. Now, this is a wave of travelers moving into London over 5 years, condensed into 15 seconds. And this is information when we couple it with ticket sales data. It gives us an idea of where people are going to be coming into London from around the world in July when the Games are occurring. Now, if we have data from event-based surveillance systems with outbreaks being reported around the world, or indicator-based surveillance or other surveillance systems, we now have a better understanding of their significance in London, and we can have interpretation of what they mean. Now, after the Games are over and people travel back to another part of the world, these bars represent where travelers are going, And the base map reflects measles vaccination immunity. This is a disease I think we're going to be wanting to watch with the Olympics. So just in summary, I think one of the biggest challenges for us is to utilize this surveillance information more effectively, and by integrating information on transportation and other contextual factors, we can really start to understand what this means locally and globally. Okay, thank you.